In today's video, we will talk about the ever popular question, should I go for my FNP or Family Nurse Practitioner if I already know I want to end up working in peds or women's health? Because you may have heard along the grapevine or you're on this forum or that forum that FNP is more marketable versus getting your women's health or pediatric NP. So if that is you and you are wondering which of the very many NP paths to take, but you already kind of know you want to end up in women's health or peds, then this one is for you. If you're new here, welcome. I'm Liz. I am a family nurse practitioner working in family medicine, and these are just my thoughts on this matter. I get asked this question a lot, so I thought it would be a good idea to make a video on it. But just remember, these are just my thoughts and opinions. This isn't like the law. You're certainly allowed to do whatever you want to do. This is just what I would do if I had wanted to end up in one of those areas. All right, so let's start off with a quick rundown of what a family nurse practitioner is. FNPs are trained to assess, diagnose, and treat patients of all ages, primarily in an outpatient setting, so like an office or an urgent care. If you want a lot more details on what an FNP is, what your scope of practice is, what procedures you usually do, and things you treat, I have a whole video that I talked all about like what an FNP is and does. I will leave it linked in the description box below, so go check that one out. Now, the type of patients that an FNP sees and the setting that they work in, this is all important when you're deciding what type of NP you want to be, because nurse practitioners are kind of weird in that everything is very specialized. You don't just go to school to be an NP, you have to pick which type you want to be, what specialty you want to be educated in. And this specialty is going to define the population and the setting that you are then going to be able to practice in, which usually is why there is this whole question of, I want to work in peds or work in women's health. What direction could I go? Because FNP kind of encompasses a lot of things, whereas peds or women's health is much more specific. So due to the super broad nature of the family nurse practitioner specialty, it's often kind of seen as just like this generalized bucket and seen as more marketable because people can go to school for it and then work in a ton of different settings and specialties. It is very, very common from what I've read on different forums and just from talking to people where people are like, oh, I definitely want to end up in women's health, but I'm just going to go for my FNP because there's more jobs. And guys, I do not love that approach. If it was me, that would not be how I would go for it. Are there more FNP jobs out there? Yes, but that's because there are a lot more family practice settings or clinics like cardiology that hire FNPs, or urgent cares or nephrology. These places all hire FNPs because they can obviously see all ages, or they don't care that you can see all ages, they just like that you did learn about adults in the case of like cardiology and nephrology. So yes, because of the broad scope and nature of an FNP specialty, there are a lot of different jobs out there, but that doesn't mean there's a lot of different jobs for FNPs in your specialty that you already know you want to do. Because if you already know what you want to do, and that is children or women's health, I would so encourage you to go to school for that specific specialty and get all of your training in it. With the caveat being, obviously, if the specialty training you want exists. So we don't really have a great one for if you want to be a cardiology NP. There's no program that only does that, but we do have them for peds, outpatient and inpatient, and women's health. And look at it this way, the job you know you want to get in women's health or peds will want to hire someone who spent literally all of their training focusing on just this population, rather than just having just part of your training be focused on those things. So while there may be less women's health jobs out there, if you had your degree in women's health, you would be highly qualified for those fewer jobs, which would make you a much more appealing job candidate. There's a few other benefits of going into your known specialty as well. Let's say you want to be a nurse practitioner and you know you want to work in pediatrics, but you aren't totally sure if you want to do a pediatric primary care NP program or a FNP program. You're kind of leaning towards FNP because you've heard that there's fewer pediatric NP jobs out there, and family nurse practitioners can see kids because you learn about them in FNP school. But this is a good point to pause and think for a moment, because do you learn about kids in FNP school? Yes, that is true. But I'm telling you, having gone through it and talked to a ton of other people in many different programs, the focus of FNP school is adults. I'd say in my program, about 10% of the education and clinical hours was dedicated to children, which is enough if that's kind of going to be the subset of the population you see on the whole. So like in practice, I see probably about 5 to 10% kids. So it makes sense that I spent so much more time working with adults because that's mostly what I see in family medicine. So if you know you want to work in pediatrics and there exist pediatric NP programs that literally only teach you about kids, wouldn't you want all of your education to apply to the career you want to get into rather than just 10% of it? As healthcare providers, I feel like it's our job to be prepared as we possibly can for our patients. And if you know that is what you want to do, you want to do pediatrics, then go do the thing. Go learn all the things about the children and go do that. Same exact situation with women's health. If you know for a fact that you want to end up in women's health, that is your jam and you love it, go to a Women's Health NP program or a CNM or a Certified Nurse Midwife program. Difference between those, CNMs can deliver babies, women's health cannot. That's really the big difference there. And this one I think is so huge because again, with the clinical hours and just the preparation that you're given in an FNP program, for women's health, I had 40 hours of clinical dedicated to women's health. It was incorporated into one of our classes, like the women's health section. It was not emphasized hugely. I did do some more women's health along the way in my FNP program. When I was in family practice settings, we would pick it up, and I feel comfortable doing it in a way now that is very integrated into primary care family practice. But if you want to do women's health and work in an office that only sees women, I feel like more than 40 hours and a little bit of information tucked into classes here and there would be majorly beneficial because you're going to be seeing the people who are getting referred from primary care, like, oh, this is kind of outside my wheelhouse. You go over here. Obviously, you'll be trained at your job, but it would be awesome if all your education backed up exactly what you want to do. Again, I feel like I'm kind of repeating myself there. If it's your passion, have all your education go towards something you're passionate about. And just as a personal note, if I'm going to a healthcare provider's office, I feel much more comfortable if, as a parent or as a patient, like my child is seen by someone who only went to school for peds, or if you're my women's healthcare provider, I hope that's what you spend a lot of time learning about. So think of yourself in this situation. Who would you rather go see if you're going into one of these kind of specialties? Because you're not going into a family medicine job. I now have an analogy for you that will help hopefully drive this point home in case it's not like abundantly clear at this point. You want to remodel your bathroom, and you're going to hire someone to help you remodel your bathroom because you are a nurse, and while you are very good at being a nurse, you aren't very good at remodeling bathrooms. Maybe you are, and that's awesome. Go you. So you have two choices of contractors. Amanda is a general contractor. She builds whole entire houses, which is very, very impressive, and she has knowledge on so many things on a very great scale and scope because she builds, like I said, whole houses. Option 2 is contractor Sophia. Contractor Sophia is obsessed with bathrooms. All she's done for the last 10 years is redesign bathrooms. She knows all the things about tiles, tubs, and toilets. She knows nothing about kitchens because Sophia doesn't care about kitchens. Sophia only designs bathrooms. If given the choice, who are you going to hire? They cost the same. Who are you going to go with to design your bathroom? Because I'm probably going to pick Sophia because all she does is bathrooms. Now, I'm not saying Amanda would not design a great bathroom, and I am in no way saying that you cannot be a great women's healthcare provider or a pediatric provider if you are a family nurse practitioner and you go and you get the additional training at your job to fill these roles. Because there are so many providers out there, I'm sure, who are wonderful providers in pediatrics or women's health who are FNPs, but I just think it would be so much easier if you hadn't picked any specialty yet, you know where you want to end up, and you could go down your specialized road just to that. Because let's be honest, if you already know what specialty you want to go into and there is a program for it, but you choose a more broad thing like FNP, you're wasting your time. Why bother to learn all the adult stuff? Because there is a lot of adult stuff if you know you never want to see anyone over the age of 21, or all the different primary care preventative measures, like all the other things that come with primary care, if all you really want to do is ladies. And in terms of being marketable by having your FNP, because you can do all the things, remember, you don't want to do all the things. You don't want to be like a jack of all trades. You have a niche, whatever that is. You already know you have a niche. You know what you want, and you want your training to be specific to that niche. Don't care that everyone else is like, oh, be an FNP, you'll know everything. You don't need to know everything because you already know what you need to know, and it's this like tiny little bubble over here of special stuff that you're gonna now be really good at. And having that niche and that specialized training will actually in turn make you more marketable for the specific job that you want. I feel like family nurse practitioners have kind of become this catch-all now that we've started specializing, and I believe that FNPs serve an amazing purpose. But if you already know what you're passionate about, and going the FNP route would kind of be just like wasting a lot of your time, to be honest, then I would do you and all your future patients a favor by dedicating all of your training to one of those two specialties that you already know you love. And this does not apply, guys, to people who are like, I don't know, I might change my mind, I'm not sure. This is for the people I've talked to who are like, I will never see anyone who is 30, or I don't ever want to see a dude. Like, very clear cut, no questions asked type of thing. Okay, hopefully that gave you a little bit of something to think about if you are trying to decide between peds, FNP, or a women's health provider specialty. My words. If it was helpful and you want to see more videos like this, consider subscribing. I'd love to have you. On Tuesdays, I have content videos just like this. And on Saturdays, I have a weekly vlog documenting my life in and out of work as a family nurse practitioner. Also head over to Instagram where I post lots of things of what I see at work. So if you're like, I don't really know if I want to do family practice, that would be an excellent thing to check out because I post what I'm learning and then what I'm seeing at work. Question of the day is, what are you kind of considering in the scheme of all this? Because I'm assuming if you clicked on this video, you're probably considering something along these lines. And why, and what are you kind of leaning towards? And then we can all look and see, and other people could get ideas or like insights. You're gonna learn a lot from each other. The comment section is always a gem. Hope you have a fabulous rest of your week, and I will see you again next time. Bye.